My name's Sarah. I'm a licensed professional counselor here at Angelus. My passion is working with people, and my kind of ideal is walking alongside people in their journeys to kind of find themselves and find healing and all of that stuff. I work with all ages, but my real passion and the place where I find a lot of joy is working with kids 12 and under. I really just love working with kiddos, and I love the playfulness and the fun and making therapy for kids something that's not so scary and allowing them to kind of be in a safe space that they can feel those feelings and provide support for them, because I know sometimes kiddos don't have the words to say how they feel, but they definitely have other tools in the way that they communicate.
Can you tell me a little bit about what your work is like with the families as part of working with kids, how they're incorporated, or what you find to be very helpful?
So I like to work with families, with kiddos especially. I tend to kind of break it up where one week I see a kiddo individually, next week I'll do a family session, or kind of sussing it out and figuring out like what exactly kind of helps. I definitely check in with parents before, after session, kind of being like, is there anything that I need to know about? Do session with kiddos, and then I usually bring parents in the last 5-10 minutes of session to just kind of wrap up, talk about what we did. And then I'm also really big on giving families homework too, to work on stuff at home, because my philosophy is that a kiddo is not just a singular person existing in their world. They have mom, dad, siblings, other caretakers, whatever it may be. So there's a lot of dynamics there, and I want holistically to include everybody in the treatment, because that's where I see a lot of wins. And I like giving parents ideas of like watching stuff and having kids label feelings about how people are feeling, and working through like having a family night and really building that rapport and warming up that relationship too is super important to me, because I want the kiddo to function the best that they can, and I want everybody to feel included and like they're kind of have a hand in the pot too.
So I know you have a lot of experience in training and working with the really little ones, the kids like under 6. Can you tell me a little bit about that? Because it can be hard to find a therapist who is open to working with those age ranges and who feels like they know where to step in and make any changes.
Yeah. So working with kiddos under 6 is honestly probably my favorite. And I think it's partially because I really have love and passion for play therapy and PCIT. Those are kind of like my bread and butter, what I love to do. I have a lot of experience working with kiddos that have ADHD, ODD, autism, all of that stuff. And PCIT specifically works on warming up familial relationships and also working on how do we consequence kids in a way that's actually helpful, and seeing meaningful change throughout therapy and then also at home, because that's the best. And then play therapy, I love, like with a capital L, because that's how kids speak. That's how kids communicate. And I really kind of work from child-led play in sessions where we're kind of playing with different things like Barbies or Legos or kind of caretaking, and I kind of pick up on major themes that exist in play therapy, and I kind of interject in certain spaces, and I do a lot of reflecting with kids, because asking questions in session for kids is kind of like a hard stop where they don't kind of want to interact and they're just kind of like, yep, nope, and then they're kind of doing whatever they want. So play therapy really is about letting the child feel like they're in control, because sometimes kiddos feel like they don't have a say or they're not feeling heard. And play therapy is really about letting that child communicate in a way that's helpful for them. And to be honest, it's actually kind of fun for me because I get to kind of tap into that like childhood piece of myself, which I also love. And play therapy, I mean, if I could do that forever, I probably would, because I just really enjoy it, and I really love PCIT because I love seeing progress. Like, that is like my biggest thing. I love seeing like healing and kids work through the play therapy themes, and that's like specifically that age range is like 2 to 6 is really where you kind of see that working the best.
When somebody is coming in and they're just starting counseling with you for the first time, whether they've been counseling with people previously or this is their very first exposure, what would that initial process look like? Let's say that first month of treatment, and especially when we're talking about small children, what do you think is the most realistic expectation for the family of like actually getting themselves committed to like this is going to take a period of time? Sometimes people come in and they're like, it's been 2 weeks, why aren't they better? And realizing there's so much steps and things that need to happen. So to not get discouraged, knowing that, I mean, you're essentially you're planting a tree, and all those roots have to get in place well before you're going to see any leaves.
So the first month kind of coming in and counseling with me, my initial session with somebody is just really kind of tell me your story, tell me what's going on, how can I help? And then we really kind of work on formulating like realistic goals. I'm a huge fan of SMART goals, where we can actually attain these things and they're realistic. And I also like to set kind of expectations for parents too. My favorite line is that working with kids is a slow burn. It's not something we're going to kind of see like instantly like changing. So I inform parents of that, and I kind of explain like, you know, sometimes parents will hear like, oh, all we did all session was play Uno or play with Barbies or do this or do that. And it's like, oh my gosh, I'm paying money for my child to play. Like, I can go home and do that with them. And I kind of explain to them like how play therapy works, because play therapy is so different than just like talking. That's how kids communicate. And it's really me picking up on the nuanced stuff. And then I really kind of pick up on like kids working through themes. And I kind of point out to parents like, kiddos are kind of starting out, maybe they're coming in with anxiety. So then they're presenting with kind of the mastery skill where they're trying to be perfect. And maybe we're playing with blocks one day and the blocks fall over and the kid's kind of melting down over them falling over, and it's like, it's ruined, it's terrible, life is terrible, I'm not good at anything. And then we're kind of working through that, and we'll see in time that the kiddo, the next time the blocks fall over, it's like, it's okay, everything's fixable. And that's what's really meaningful. So the first 4 weeks, I definitely kind of set expectations for parents, and I also kind of, really in that time, I kind of loop parents in of like, this is what we're working on, and this is what you could be working on at home too. So it's kind of like we're pulling the whole thing in. And I definitely have parents kind of check in with me of like how they feel like sessions are going and what coping skills I'm kind of sending home to work on is going for them. But definitely the first 4 weeks is like, for me as a clinician, is like rapport building. Kiddos take a while to kind of open up and trust an adult. So I really want to work on like that rapport building with kiddos, rapport building with the families. Definitely kind of just getting to know each other and feeling comfortable, because I've had kiddos before in sessions where the caretaker kind of leaves the room and they kind of look like a deer in the headlights, and it's like, oh, what am I doing in here? And I really kind of like to start out slow, and I kind of explain that to the parents, like, this isn't a sprint, it's a marathon, and the way that we get to the end of the marathon is slow, steady. We're not going to start out at a sprint and kind of burn ourselves out before we even get to the finish line.
How is it a difference when you work with teenagers? You know, obviously 13 to 18 is a whole different breed of human.
Right.
Tell me a little bit about your work with adolescents.
Yeah, my work with teens, specifically like 13 to like 17, 18, is different in the way of like, I love to use their lingo and kind of rapport build in that way. And something that's fun with kids, well, teens, is like making jokes about like myself being old, quote unquote, because I've had teens tell me that I'm old, and I'm just kind of like, yeah, I kind of am old. And it's really about, for me, working with teens, like tapping back into that time when I was that age and what life was like and how developmentally different it is. And I definitely tell parents that, because sometimes they get frustrated and they're like, oh, like my teen doesn't want anything to do with me, or they don't want to clean their room. And I'm like, remember, they don't have a prefrontal cortex. That's a little different than me and you coming home and seeing like a mess in the kitchen and we're like, oh, this needs cleaned up. Teens are just kind of like, oh, it needs cleaned up. I'm going to go over here and play on my Xbox. Because teens aren't having that higher level of thinking yet. And it's kind of unfair to expect an adult version of somebody that's not an adult. But working with teens, I also incorporate a lot of games, because I found a lot of my teens love playing games. And it kind of relieves that pressure of like me staring at them and being like, so tell me about your day. Because I mean, how many times do people ask teens that? And they're like, oh, it's fine. Because it's like they get asked that all the time. So I like to personally talk about like highs and lows. I also share my own highs and lows because it's important for them to feel connected to me. And then we usually play some type of game, which is fun, or we complete worksheets, or we do coping skills. Teens, I'm just very much so myself, and I very much so give them kind of the realistic, like meeting them at where they're at, because I'm obviously not going to counsel a teen the way I would an adult. So my lingo is different, my therapeutic approach is different. It's usually a little bit more laid back and not kind of adding pressure, because teens have a lot of pressures in their life, and I don't want them to come to therapy and be like, oh God, I got to talk to Miss Sarah, and that's just another pressure in my life that I don't want to do. So I try to make it fun and laid back and relaxing, because teens have a lot of stress in their life. And if therapy can be a safe space where we kind of play Jenga or Trouble or something else, and we can just chit chat about the day, that's great. I really think that that's a difference maker for them.
How is communicating and working with families different for teenagers than it is for smaller children?
Mm-hmm. Communicating with families, with teens versus little kiddos, is different in the way of, a lot of times when I talk to parents with teens, it's a lot of like frustrations. Like, I had this wonderful child that was living in my house, and it was like overnight they're like from another planet, and I don't know what's going on. And I really give a lot of psychoeducation to parents, especially of teens, of like, this is what's developmentally important to them right now. And I also explain to parents like, the shift is different, whereas like kiddos' main priorities are like family and like coming home to my family, and like that's really what they're about. That's what their world kind of revolves around. Whereas teens are kind of shifting more towards like friendships and stuff. So I explain that to parents of like, it's not that your teen hates you. This is what's developmentally appropriate. We want kids to kind of be independent and kind of figure out who they are and what's going on, and we want to support that in the best way possible. So I definitely work with parents on like, this is what's developmentally appropriate. And I also hear parents out, because that's a difficult thing to have a kiddo that, you know, loved and adored you and loved the snuggles, and then all of a sudden it's like, get away from me, I don't ever want to speak to you. Don't talk to me before 7 a.m. And it's it's challenging, and I hold space for parents because that is difficult to kind of bridge that over. But I also talk to parents about having time with their teen that's not instructional, where it's not like, how was your day? I'm asking you a million questions. It's more like, hey, I saw you were watching X, Y, and Z on YouTube or TikTok. Like, tell me more about that. That's so interesting. Or like finding something that they can connect on that's not necessarily asking a million questions.
Tell me one thing about yourself that may surprise people, whether it's something you really enjoy or something that you've done that may not be the normal.
Let me think. Hmm. Something that surprises people a lot about me, and I know is kind of like, people look at me, and there's obviously like a stereotype, you know, people do that because it's easy. But something that's different about me is that I love PC gaming. Um, and like, I'm actually like a closeted nerd. I definitely have my fiance and my older brother to thank for that. But that's definitely something about me that people normally wouldn't think. Because I'm super girly and I love like makeup and hair and perfume and dressing cute and all this stuff. But I like love that stuff. Like, I mean, I have a Pokemon tattoo. And like I go to like Comic Cons and stuff, and I like love that stuff, and I love like Fallout and other PC games, and that's just kind of something about me that people usually don't expect. Because I kind of, people have told me before when I tell them that, they're like, oh, you don't like fit into that category, like you kind of look a little different being in that category. I'm like, yeah, but like there's more to me than what you can kind of see, you know, on the surface. So that's something that definitely surprises people. Like when I tell people like, yeah, I'm going to Comic-Con and I'm gonna dress like this, people are like, oh, okay.
Love that.
Yeah.
Thank you so much for taking the time to just have a little comfortable interview, no prep work, just to give our people a chance to get to know you a little bit and to see if that you might be a fit for them or for their family.
Yeah.
I actually probably should ask, I skipped the whole thing about adults, but you also do see adults.
Yes.
Can you just tell me a small bit about that? What is it like working with an adult, and where do you thrive? Are there certain adults that you find that you're able to help more than others?
So I do work with adults, which honestly was something that if somebody would have asked me when I was in grad school if that's something I wanted to do, I would have been like, no way. I do not want to work with adults. But they've grown on me, and I really enjoy it. I've seen all kinds of things with adults that, I mean, I work with a lot of PTSD. I'm actually trained in like PTSD treatment, CPT to be exact, which is really helpful. I do a lot of like DBT, CBT, kind of whatever an adult brings into the arena, I'm very helpful with. But I've noticed a lot of the adults that I see tend to have diagnoses of like anxiety or depression or kind of issues with like interpersonal relationships and like boundary setting and like communication. Like that's kind of what I really see a lot of. Which, I mean, I never thought that I would do it in a million years, but I actually really enjoy it. So I have a lot of adults that I see now, and I really love working with them. And it's definitely different than working with kids, but there's a different type of kind of meaning making with adults for me.
Thank you so much.
Yeah.